Welcome to the down and dirty demo of the virtual exam room and Care Central Cloud services. As you can see, a clinician or a physician only needs to log into a web browser and choose either the clinician or the administrator portal. All administrative actions such as adding in patients and working with different records are done on the administrator side. And on the clinician side is where we do all virtual exams and diagnostics and gather data. Going into the patient list, we have a theoretically unlimited number of patients we can put on this cloud-enabled server. Clicking into their record, we can see who they are, a quick snapshot of trends and history and recent exam data that we've collected. This all is securely stored on a HIPAA-compliant cloud server. Our data is secure at rest, secure in transit, and secure on the cloud. We are AES encrypted 256-bit, and we have a very excellent data compression algorithm which allows us to transmit data, video, and audio over an extremely limited bandwidth. We're now going to enter into a virtual exam with our Chief Medical Officer, Dr. Jonathan Baugh, who's out in Utah. This end is currently in Richmond, Virginia. Hello, Dr. Baugh.
Hi.
So we're going to do a quick demo virtual exam for our audience. And let's just run an SpO2 and a EKG and a stethoscope test.
Sounds great.
So if we're in a bandwidth constrained environment, we can also switch to audio only, and you will see diagnostic information coming across on our end as soon as the pulse oximetry test starts. Wonderful. Thank you, Dr. Baugh.
You saved that?
Yep. Now
this is a 3-lead EKG. With a little Ekg Simulator.
Why is that important on your end as an emergency room physician?
You know, the ability to be able to see an EKG from a patient prior to arrival saves lives. You can do both 3-lead from the field or 12-lead from the field. It really changes the way we manage patients if we can see this live coming across while we're actually seeing the patient as well. It's incredible.
Thanks.
Now that's part of the record and can be seen anywhere in the world by appropriate providers.
Excellent.
We're going to do one last little test here. That's a stethoscope.
Now, if we had on headphones, we would be listening to the heart and or lung sounds depending on where he is in the stethoscope test. But the audio for the purposes of this demo becomes muted as the way that the software is set up. So anyway, you can see the live telemetry coming across. That's frankly what separates us from everyone else, is the ability to push live data, video, and audio at the same time. Thank you, Dr. Baugh. And I want to show real quick what happens in a bandwidth constrained environment. So by switching to audio only, we can still hear Dr. Baugh, and we can also see real-time data. If you wouldn't mind pushing that SpO2 one more time, that would be great.
Now you can still hear me, but we definitely drop down our bandwidth dramatically.
We're now operating around 80 to 100 kilobits a second, whereas with the video, we're anywhere from minimum of 256 KB up to 2 megabits. And that would be with audio and streaming data. Thanks a lot, John. We're going to call you from the car. We're going mobile, and if you wouldn't mind, you can be the doctor and we'll be the patient.
Sounds perfect.
Thanks.